BrainFit for a better life. The new knowledge base of brain health departs from the following well-documented facts. Brain health is central to all health and success in life. When your brain works correctly, you will make better decisions, which results in a happier and more successful life. When your brain is troubled, for whatever reason, you are likely to be sadder, sicker, poorer, stressed, and less successful. The good news is that you are not stuck with the current poor condition of your brain, and no matter what age you are, you can improve your brain. Your brain's history is not your destiny if you decide to care for your brain from today onwards. Start making lifestyle changes to prevent brain function decline as soon as possible. It's never too late to start, but the sooner you begin, the more benefits you will gain, and you will reap the benefits of a better life.
I am Willem Mostert, and I have a doctorate degree in social sciences. I want to share with you how BrainFit was established. For the past 40 years, I've been assisting organizations, management teams, and individuals to improve their performance. About 3 years ago, I realized that my memory was declining. I struggled to remember the names of people and things and even telephone numbers. My short-term memory was definitely affected. During this time, I was also diagnosed with diabetes 2, high cholesterol, and even high blood pressure. I told the doctor that my memory was fading, but he said it is normal when we get older. I later realized that by saying this, he did not do me a favor. He should have identified my risk factors and told me it is time to start caring for my brain by quitting all my bad habits. Then in February 2019, I had a serious motor accident and was unconscious for quite a while. My eyes were damaged and I went to consult an eye doctor. He suggested I make an appointment to go and see a neurologist. The neurologist said that he could not find much wrong with me, even though I struggled with some of the memory tests I did. He, however, sent me for an MRI scan. The report came back and it indicated that I have excessive, bilateral, fairly symmetric parietal lobe atrophy, which raises the suspicion of Alzheimer's disease. The opinion of the neurologist was that I do not have Alzheimer's and that I should take it easy and see him again in 6 months. He was sure that my minor memory lapses were due to the accident. I also consulted 3 other neurologists and they all came back to me with the same conclusion. Take life easy and see me in 6 months. I knew that something did not add up because they all ignored my personal observations regarding when my memory problem started and attributed my symptoms to the accident alone. I, however, knew that my memory loss started long before the accident. In the meantime, my symptoms got worse. I mixed up people's names, forgot the names of people and things I knew so well. I also had navigation problems. When I get to a place I deliberately went to do something, but when I got there, I could not remember why I went there. I began to lose my self-confidence, began to have suicidal thoughts, and my overall functioning was really worse. I knew that something was wrong with me, and I said to myself that my destiny is in my own hands, and I better do something about it to save myself. I prayed to God for help, and the knowledge that saved me kept rolling in. The first thing I did was to consult Dr. Google by asking the question, can Alzheimer's be reversed? The top line of my research was an extract from a book written by a Dr. Dale Bredesen, named The End of Alzheimer's. He is professor of neurology at the University of California. Dr. Bredesen has been doing research on Alzheimer's for 30 years and identified 36 biomarkers that can contribute to cognitive decline. At the time of publishing his book in 2018, he already had the results of 100 patients he treated, and all of them showed improvement in their cognitive functioning. The results Dr. Bredesen got was astonishing, taking into account that Alzheimer's is a progressive disease that only gets worse. The scientific literature, however, states that there is currently no treatment and cure for Alzheimer's, and that the current medication is less than 1% effective. I ask myself, is this Dr. Bredesen a cheat or easy onto something here that can help me. I nevertheless decided to follow the protocols prescribed by Dr. Bredesen. I was deficient in 13 of the 36 biomarkers and began to correct these deficiencies. I then decided to continue my research. I asked Esther Marie Joubert, a longtime colleague, to join me in the quest to find out what can be done to reverse memory loss. We spent another 8 months researching the field of dementia prevention and was astonished to find out how much scientific literature is actually available with proof that dementia can be prevented and even reversed.
My name is Esther Marie Joubert and I have a master's degree in social sciences. The next specialist we found was Dr. Daniel Amen, the founder of 8 Amen clinics in the USA. His research and clinical results confirmed Dr. Bredesen's work. What Dr. Amen and Bredesen found out is that cognitive decline already starts in the brain about 30 years before one is diagnosed with Alzheimer's. Amongst the doctors who focus on preventing dementia and its worst form, Alzheimer's, there is general consensus that dementia is caused by 4 factors, namely chronic inflammation, a shortage of brain supportive nutrients, hormonal imbalances, and finally toxins. According to them, deficiencies in each of the 36 biomarkers can be identified with blood tests or MRI and PET scans and be corrected to its optimal levels. Dr. Amen developed a very practical approach by identifying 11 risk factors for dementia that can easily be determined with a series of questionnaires, supported by the mentioned blood test if necessary. These risk factors are poor blood flow to the brain, early brain retirement by not learning new things, chronic inflammation, genetic predisposition for dementia, head trauma, toxins, poor mental health, infections and poor immunity, neurohormone deficiencies, diabetes and obesity, and finally sleep problems. These risk factors and how to mitigate them are well addressed in our Brain Healthy Habits programs.
Our research on dementia prevention then led us to the relatively new development in medicine, namely functional medicine. Dr. Mark Hyman says that the focus of functional medicine is on creating health rather than treating disease. They see the body as a whole system and not consisting of separate parts. The body parts must work together in harmony to ensure health, and when they do not, disease occurs. That is why you have to check all of the 36 biomarkers. Functional medicine, therefore, helps you to prevent disease by creating health. It became clear why one pill for Alzheimer's cannot correct 36 potential causes. We realized that in the absence of a pill to cure dementia, the current medical model might not be appropriate and that a different model needs to be practiced. For dementia, it is therefore clear that prevention is better than cure. To ensure brain health, one should identify the risk factors, then remove these risk factors, and then adopt healthy lifestyle habits to ensure that these risk factors can no more harm your brain. Our conclusion is that if a pill is not available, and all 4 of the major causes of dementia can be influenced by our lifestyle choices we make, then dementia can be prevented and even reversed to a large degree.
Our next stop was with Dr. Lisa Mosconi. She is the Director of Women's Brain Initiative at Cornell Medical College in the USA. Almost all of the knowledge that we found thus far was generic, and the only risk factor that differentiated women from men was the neurohormonal risk. We therefore developed a generic program that both men and women can attend, with only a small section on female hormones. Reading Dr. Mosconi's work, we realized how wrong we were. Her extensive research in how the female brain reacts differently to the onslaughts compared to the brains of men opened our eyes. Our first reaction was that we also fell into the trap of the bikini syndrome, namely that the only difference between men and women from a medical perspective is what is covered by a bikini. We now know that this view of women when it comes to medical care is not only short-sighted, but in fact an injustice to women in general. Dr. Mosconi provides evidence of how the female brain warrants a different approach to ensure cognitive health for women. Her research found that 2 out of every 3 Alzheimer's patients are women. Women in their 60s are about twice as likely to develop Alzheimer's over the rest of their lives as they are to develop breast cancer. A 45-year-old woman has a 1 in 5 chance of developing Alzheimer's during her remaining life, while a man of the same age only has a 1 in 10 chance. We realize that the female brain is not covered by a bikini and that women need a tailor-made program to empower them with the knowledge to navigate their own brain health. This will help them to have an informed discussion with a medical practitioner when it comes to how a woman's brain reacts to being a woman. Hence our decision to make available a unique program for women only.
By now, we were convinced that there is much we can do to prevent and or reverse dementia if we start caring for our brains. Something I admit never crossed my mind before. I was also sure that our lifestyle choices play a significant role in whether we develop memory loss or not. As social scientists, we made the conclusion that our habits must be playing a major role in these risk factors for dementia, because something that can damage our brain so much must occur repeatedly, and that is what a habit is. Something you do over and over without even thinking of it. We now set out to learn more about habits and came across Charles Duhigg. He studied this topic for many years. He developed a model for identifying the elements of a habit and the method of changing bad habits and how to create new healthy habits. Our picture was now completed. I now know that there is a scientific knowledge basis available to help me sort out my memory problems if I make serious choices for myself. Firstly, I had to identify my risk factors. Then, to develop plans to mitigate these risks. And finally, to de-learn my bad habits and learn to adopt new brain healthy habits so I can care for my brain. As we progressed through our research, I implemented the knowledge I got from these world-renowned specialists, and in February 2020, I went for a PET scan, which is the most sensitive test to identify early dementia problems. My results came back and indicated that I have a normal brain. I knew this way before I got the results, because the memory problems I had before was all gone, because I changed my lifestyle significantly. I now know 3 things. 1, the human body grows old and so does the brain. The brain begins to decline at the age of around 40. The brain, however, sometimes grows older at a different rate to the biological aging of the person. And that the rate of brain aging is determined by a combination of adverse and favorable influences of healthy and bad habits, and this determines a person's cognitive status. Secondly, to care for my brain should really be a no-brainer. And lastly, that we have access to knowledge now that we must make available to people who want to care for their brains. And that is how BrainFit was established.
We make scientific-based brain healthy habits available to those who want to maximize their brain capacity so that they can ensure a life full of quality and independence. The best way to start this process is to enroll for the Brain Health Risk self-screening. Once you know what your risk profile is, you can decide which program suits you best. Please refer to the website for more information on this. If you need medical intervention or any other specialist assistance, we will work with you and these specialists to maximize your cognitive functioning.
Remember, you are responsible for your own health and to prevent illness. Your doctor is responsible to help you when you are ill. So, start caring for your brain from today onwards. Without a healthy brain, you and your whole body will suffer.
Start making lifestyle changes to prevent brain function decline as soon as possible. It's never too late to start, but the sooner you begin, the more benefits you will gain. And you will reap the benefits of a better life.